Okay, let's unpack this. E-scooters, electric scooters, they were sort of sold to us as this great sustainable way to get around cities for short trips. But, well, as they've popped up everywhere, ERs have seen this huge spike in visits. So today we're doing a deep dive into the public health side of these scooter injuries. And we're really focusing on maybe the most worrying part, substance use.
That really is the crux of it, isn't it? On one hand, you have the convenience argument from mobility folks, but on the other, trauma specialists like myself, we're seeing these really severe, often preventable injuries. And the specific role of impairment, whether it's alcohol, opioids, marijuana, cocaine, it's been, well, recognized but not really quantified properly on a national scale until recently. Substance use, it directly hits the functions you absolutely need for riding safely, your balance reaction time, your executive function, making good decisions.
Right. So our goal here is to pull together the findings from this big study. It used, 5 years of national inpatient data from 2016 to 2021. We want to understand the national picture, how common this is, and what the real clinical and actually economic outcomes are when substance use is involved in scooter crashes bad enough to land someone in the hospital. We're aiming to get you up to speed quickly on this sort of tricky intersection of city travel and trauma. Okay, let's start with the trend itself, because the growth rate is frankly shocking. This whole thing just exploded in only a few years.
Oh, absolutely. It was an exponential rise in hospitalizations. Think about this. In 2016, nationally, there were about 330 hospitalizations linked to scooters. Just 5 years later, by 2021, that number jumped to 2,705.
Wow.
That's more than an 8-fold increase in cases needing serious hospital care in just 5 years.
An 8-fold rise. I mean, that points to more people riding scooters overall, which makes sense. But the impairment piece within those injuries, that's what really jumps out. The study estimated about 7,350 patients admitted for severe scooter injuries over that time. And nearly a quarter, 24.8%, had substance use noted right there in their medical records.
Exactly. 1 in 4 hospitalized riders was impaired.
1 in 4.
Yeah. So when you see a number that high, you have to ask, okay, was this rise just general, or was impairment actually pushing these numbers up faster? And the study helps break that down. It looked at who was using what. Alcohol use specifically really surged among 2 main groups, the 18 to 25-year-olds and the 26 to 40-year-olds. It paints a pretty clear picture, unfortunately, of easy access to both alcohol and scooters, leading to more severe injuries in young and middle-aged adults.
Were there, demographic patterns that stood out for the impaired group?
Yes, definitely. Patients admitted with substance use were statistically way more likely to be male, about 78% of the impaired group versus maybe 64% of the non-impaired group. And they were also more likely to be identified as white, around 67% compared to 61% in the non-substance use group.
Yeah.
Another thing the researchers pointed out was a significant rise in opioid involvement, especially among riders aged 26 to 40 and 41 to 64.
Okay.
They linked that finding, understandably, to the broader opioid crisis we've been seeing across the U.S.
All right, so we've got the numbers on who's getting hurt. Now let's shift to the consequences of those injuries. Here's where it gets really interesting. Because being impaired seems to fundamentally change how you crash.
It absolutely does. Impaired riders, pretty consistently, had greater overall injury severity. In trauma care, we use this thing called the TMPM score. It helps us quickly gauge how likely someone is to survive their injuries. And patients with substance use, they consistently scored higher on that severity scale. They were also much more likely to have injuries to the head and neck. We're talking 23.6% of the impaired group, compared to just 14.3% of the non-impaired folks.
Okay, more severe overall, more head neck injuries. But I saw something in the data that seemed odd. Impaired riders were actually less likely to have long bone fractures, like broken arms or legs. How does that work?
Yeah, that sounds counterintuitive,
Yeah.
but it actually gives us a key insight into, well, the biomechanics of falling while impaired.
Right.
See, when you're sober and you know you're about to crash, your brain kicks in. You try to brace yourself. You put your hands out.
Right. Instinct.
Exactly. And that often leads to broken wrists, arms, maybe legs. But when you're impaired, that protective response is slowed down, or sometimes it's just absent. So instead of bracing, you might fall more rigidly, almost like a log. And that often leads to the most critical risk, traumatic brain injury, TBI.
Let's zero in on TBI then, because that risk seemed to jump dramatically.
It basically doubles. TBI was diagnosed in almost 40%, 39.3% of the impaired riders. Compare that to just over 21%, 21.4% for the non-impaired riders.
Wow.
And even more concerning, when the researchers adjusted for everything else like age where the accident happened, The type of crash impairment alone increased the odds of getting a TBI by 1.65 times.
Okay, so a 65% higher risk just from being impaired.
That's the real danger of riding compromise.
So that link between substance use and TBI is crystal clear. But let's connect the dots a bit more. Why such a massive spike in head injuries specifically? Is it just balance and reaction time?
Well, that's a big part of it, the physical compromise. But there's a behavioral piece too, and it's crucial. Other research has shown that people using micromobility, like scooters, were over twice as likely not to wear a helmet if they were under the influence of alcohol.
Ah,
So
okay.
you combine poor balance, slower reactions, and ditching the helmet. The head often becomes the main point of impact. It's a dangerous combination.
Makes sense. But despite this higher severity and this really devastating TBI risk, the study found something surprising about the ultimate outcome, didn't it? Like mortality.
Yeah, that's a really important nuance here. Even though they suffered much more severe injuries, the rate of dying in the hospital was actually similar between the two groups. And the length of stay in the hospital was identical, a median of 3 days for both impaired and non-impaired riders.
3 days for both.
3 days. So the injuries are definitely severe, they're life-threatening, but modern trauma care is, thankfully, saving a lot of these patients. It just comes at a significant cost.
Okay, that leads us perfectly into the next piece, the system impact. The money side. If riders are surviving these much worse injuries, the costs must be going up quite a bit. Let's talk dollars and cents.
Exactly. The clinical outcome is tragic for the individual, but the systemic outcome is, well, expensive for everyone. Even though patients stayed that same median of 3 days, the actual cost of their hospitalization was significantly higher if they were impaired. The researchers calculated it out. After adjusting for other factors like injury severity and patient demographics, substance use added about $4,700 to the cost of that initial hospital stay.
An extra $4,700 per patient. Just like that. Where does that extra cost come from if they aren't staying longer?
Well, it really reflects the intensity and the specialized care needed when you're managing both severe trauma and substance use at the same time. Think about it. You need more resources, maybe more specialized nursing staff, potentially more time from the trauma surgeons for complex interventions. Plus, you have the costs of medications needed specifically to manage withdrawal symptoms or acute intoxication, all while the patient is trying to recover from, say, a major head injury.
Right. It's not just paperwork, it's actual intensive medical resources needed to handle that dual crisis.
Precisely. And this extra demand, specifically from intoxicated riders, puts a real measurable strain on trauma centers, especially those in the busy urban areas where, scooter use is most concentrated. These systems are often already stretched pretty thin.
Okay, so summing up, we've got rising numbers, a much higher risk of severe brain injuries, and significantly higher costs. It seems pretty clear that whatever we're doing now, regulation-wise, isn't really protecting the group most at risk here, impaired adults.
Right. And if we connect this to the bigger picture, what these findings really scream is that we need a much more robust, multifaceted approach, one that's laser-focused on prevention. The study points out a major gap: helmet laws. Most states only require them for riders under 18. But we just saw the highest rates of substance use are in adults, people over 18, often well over 18. So those laws are kind of missing the mark for this high-risk group.
So what's needed then? I mean, mandatory helmet laws for adults, they always seem to run into political headwinds, don't they?
They often do, yes. But the clinical data here is pretty compelling support for them. Really, the strategy needs multiple parts. Yes, legislative reforms like helmet mandates for everyone, but also really aggressive community education campaigns, specifically about scooter safety and impairment. Substance use prevention programs need to explicitly talk about scooter risks. And we can't forget infrastructure, things like protected bike lanes. They help reduce the chance of collisions, especially with cars in busy city traffic.
Okay, that covers the prevention side, helmets, education, safer streets. But what about sort of intervening closer to the decision point? The study mentioned how bars and scooter docks often end up clustered in the same spots, right?
Yeah, that proximity is a huge piece of the puzzle. It's convenient, but it's also problematic. The ultimate challenge really is, how do you effectively separate the decision to drink or use substances from the immediate ability to just hop on a scooter? This is where technology could play a role, though. Like you said, it gets complicated fast with policy and privacy concerns.
Like what kind of tech?
Well, some cities are experimenting with things like geofencing, basically restricting scooter use late at night in entertainment districts. Or maybe even systems using sensors in your phone to detect movement patterns that might suggest impairment before the scooter even unlocks.
That's definitely a complex discussion. Restricting access based on location or time or perceived state, that raises all sorts of questions about personal freedom.
It absolutely does. There are no easy answers there.
But the cost of doing nothing, measured in severe brain injuries and escalating healthcare expenses, is becoming very clear and quantifiable now.
That's the key takeaway. Trauma surgeons, emergency departments were the ones dealing with the aftermath frequently. The sheer severity of these injuries really demands action, likely through legislative reform at state and local levels. The goal has to be reducing substance use overall, but also finding ways to mitigate these devastating injuries when impairment does happen. Hashtag outre out.
So the rapid spread of e-scooters, it's clear, especially when you mix in substance use, creates this really serious and frankly worsening public health challenge. This combination of risky behavior and easy access just sends the risk of devastating traumatic brain injury through the roof, and it puts a huge financial burden on our whole healthcare system.
And just looping back to that point about proximity, bars and scooter hubs being in the same places, it leaves us with a pretty tough question for you to think about as you go about your day in the city. We know from the science that people under the influence are much less likely to do voluntary safety things like putting on a helmet. So how effective can technology or local rules really be in creating some kind of mandatory separation? Maybe time limits, maybe location blocks between having drinks and grabbing a scooter. That fundamental collision between urban convenience and public safety. Well, that's one of the big challenges we're facing now.